Welcome to this clinical walkthrough on nosebleed on anticoagulants, a key case for the UKMLA, brought to you by Mediate, your 24/7 practice partner. All right, so today we're going to break down this OSCE station into 6 key stages. If you can master this structure, you'll hit every single critical point and come across as confident and super professional. Okay, first up, opening the consultation. Those first few moments are so important for building trust. Your whole goal here is just to create a comfortable space, right? Because a calm patient is one who's going to talk to you. You want to start with something really simple and open, just like, how can I help? This is such a powerful way to begin. It lets the patient start their own story, in their own words. And boom, right away, you get a clear idea of what's on their mind. Next, we're diving into history taking. Now, this is where you really get to be a clinical detective. Your mission is to ask smart, targeted questions. Think of it like you're piecing together a puzzle to figure out what's really going on. So these are your go-to opening questions. You'll ask, what were you doing when it started? You're looking for triggers there. Any bleeding elsewhere? That helps you screen for a bigger systemic problem. And of course, the simple stuff. Any trauma, any nose picking, all of that helps you rule out local causes. See, every single question has a clear clinical job to do. Now, this next question is the absolute key to this whole case. You have to ask about all medications. And I mean everything. Over-the-counter stuff, supplements, the whole shebang. They can all play a role in bleeding. And there it is. The moment the patient says they're on an anticoagulant, say, Apixaban, that's the turning point. The entire consultation just pivots. You've now got your number one suspect for this nosebleed. But don't just stop there. Once you know the medication, you've got to dig a little deeper. Why are you taking it? How long have you been on it? Do you take it exactly as prescribed? And does your GP keep an eye on things? These follow-up questions are crucial for figuring out if they understand their treatment and if it's actually safe for them. Okay, moving on. It's time to gather some hard evidence. You need to tell the examiner that you want to do an examination and run some initial tests. This shows them you're thinking like a doctor, being thorough and following a clear clinical plan. And you can use this exact phrase right here. It's polite, it's clear, and it's professional. You're not just asking for consent, you're explaining what you're going to do and why. This shows real respect for the patient, and that's a core communication skill the examiners are looking for. And look, knowing what to say is one thing, but being able to say it confidently when you're under pressure, that's a whole different ballgame. A quick reminder, you can practice this exact case right now and get objective feedback on mymediate.com. It's honestly the best way to build up that confidence for exam day. Right, let's talk about giving the diagnosis. Clarity here is everything. You have to drop the medical jargon. Your explanation has to be super simple so anyone can get it. Just connect their symptom, the nosebleed, directly to the cause. This sentence right here, it's pretty much perfect. It's direct, it tells them the likely cause, it names the specific medication, and then it explains what that medication does in plain English. It's a blood thinner. This is exactly the kind of patient-friendly language that scores points. Every good management plan needs a solid structure. So you're going to break it down into 3 parts. What to do right now, what might happen at the hospital, and what to do for the next 24 hours. This makes it super easy for the patient to remember and shows the examiner you're thinking about the whole picture. Okay, and this is your first and most important step in management. In the OSCE and in real life, you are never expected to make big decisions about anticoagulants by yourself. Always say you'll involve a senior colleague. It's a huge safety step and it will score you big points. Next up, you need to give them some practical first aid advice. Walk them through these steps one by one. Tell them to sit down and lean forward. That's so important, not back, so they don't swallow blood. Then explain how to pinch the soft part of their nose and to hold it tight for a good 10 to 15 minutes. You also need to explain what could happen if the bleeding just doesn't stop. Talk about cautery. You can describe it as sealing the blood vessel with a special chemical stick. And then packing, placing special sponges in the nose to apply pressure. See, simple explanations like that work best. And what they do after the bleed stops is just as important as stopping it. Give them a clear list of things not to do for the next 24 hours. No hot drinks, no heavy exercise, and definitely no picking their nose. Every single one of these instructions is about one thing: protecting that new clot so the bleeding doesn't start all over again. And last, but definitely not least, safety netting. This is an absolute must-do for any safe consultation. You have to give the patient crystal clear instructions about when they need to get urgent help. No room for confusion.
Think of these as your red flags. You need to go through them with the patient one by one and make it super clear that if any of these things happen, they need to go straight to A&E or call an ambulance. Be really specific. For example, if the bleeding doesn't stop after 15 minutes of pinching your nose, or if you start to feel really weak or dizzy, these are emergencies.
And that's it. That covers all the key steps for this station. If you follow this structure, you'll be set up for success. And to really nail it down, remember, you can practice this exact case right now on mymediate.com. So, to wrap up, here's a little something to think about. Your patient is on this anticoagulant for a very important reason, right? Maybe they've had a DVT. So, how are you going to handle it if they get really anxious about the idea of stopping it, even for a short time? Think about how you'd balance their very real fears with the immediate need to keep them safe from the bleeding.